So my name is Agam Dewan. I'm a board certified psychiatrist and have helped over 200 PMHNPs and FNPs gain clinical confidence in their psychiatric diagnosis skills, treatment skills, and getting over imposter syndrome to help their patients get better results. So this video, I'm going to be covering collaborating psychiatrists and specifically how to find a good one, how to assess if they're good. So a mistake that I see so many PMHNPs making, like, especially they come in a coaching program, and so they tell me this stuff, is that their collaborating doctor is not good. They don't help them, they don't teach them, they just take their money, they're not accessible, all variety of complaints. And so you want to avoid that, right? Because if you're going to be paying money each month, you want to make sure that they are doing their job and that they're getting you value in your life and your career. So I have 5 things that you should look out for when you are looking for a collaborating psychiatrist. So number 5 is credentials. So basically what you want to do is you want to check, of course, that they're a psychiatrist. So make sure that they're an MD and a DO, and that's what their degree is. Any other degree is not a psychiatrist. They might be some other psych-affiliated field, whatever, but they are not a psychiatrist. You want to check they're an MD or DO. Next, you want to check that they're a psychiatrist. So if you're a psych NP, you don't want like a general family practice doctor or some other specialty to do your collaboration. Can they do it legally? Yes. Is it going to be helpful to you clinically? No. You ideally want a psychiatrist to cover all that, even if you have to pay them extra, because that's what's going to get you the most value clinically. They can help you with your patients, help you with confidence, etc., etc. MDDO and psychiatrist. And then further on from psychiatrists, there are different specialties. For example, so I am a child and adolescent psychiatrist. So if you're wanting to work with kids, for example, then I can be an excellent asset as a collaborating psychiatrist. But there's also geriatric psychiatrists. So they've done a fellowship in geriatrics. There are forensic. There's consult liaison psychiatrists. Obviously, just general psychiatrists as well, who kind of have expertise in a lot of different areas. So you see how there's all these different fields of psychiatry? They have different specializations. And so those different specializations have different expertises. So you want to make sure that the psychiatrist you have has the expertise that you are needing to. So that's where the credentials really come in. So number 4, and this is a big one, are they accessible? So a lot of PMHNPs tell me that when they start their new job, so they're excited, they have a collaborating psych, only to find out that the collaborating psych doesn't really do anything. They don't answer their calls or texts, or maybe they're delayed about it, or they might wait like a couple days, or they say that they're too busy, because they are, like, they're seeing their own patients too. For example, one of our NPs told me that, yeah, she started a new practice and they gave her a Collaborator and everything, and she was so excited. And then, she had 20 patients a day. And then when she would reach out to the psych for help, they would say, oh yeah, well, I'm seeing my own patients. So they weren't really able to get much benefit out of that. So she left that job very quickly. So you need to make sure they're accessible. So answering messages, calls, one-on-one check-ins, like, once a month or something. Basically making sure that they are able to be reached, and you feel comfortable reaching out to them too. Because if you feel like you're bothering them, then it's not going to be a good relationship that either of you have. So that is number 4. So number 3 is practice fit. So this comes into what I was saying earlier too, but you got to make sure that their style, more in depth, matches with your style. So for example, I've had psychiatrists who were very liberal on benzo prescriptions, and I've had who are very conservative on benzos. But when I was in my 3rd year of residency, I remember we inherited this patient. She was like 75 years old. She was on 4 milligrams of Xanax and I think like 15 milligrams of Restoril. And so she'd been hooked on these for so long, it was nearly impossible to help her get off of that medication. The that psychiatrist had retired, and so we got a lot of his patients, and he was notoriously very benzo heavy. But then consequently, I had an attending. I remember I had this patient who had witnessed some kind of domestic disturbance, and she was having a lot of anxiety. And she had been prescribed Xanax in the past, and she wanted to restart that again. And so in my mind, I was like, yeah, like that seems like a very reasonable instance of it. No evidence of abuse or anything. But the attending was absolutely like, no, no, we'll not do that. She's already on like a SSRI. That should be enough. So I remember I had to break that news to the patient, and the patient got distraught, and then she never came back to the clinic again. So the conservative versus more like liberal prescribing, right? And people have different practice, conservative versus liberal. And so the nice benefit of and I don't mean politically, but like in terms of just like controlled substances and things. The nice advantage that I got in residency was I got to work with a variety of different psychiatrists. And because of that, some were more liberal, some were conservative, some had different ideas and beliefs about different things. So I got to take in bits and pieces of each one and then incorporate it into my own practice. But if you only have one person, then you have to make sure that person at least aligns with your fit. Some of them supplements versus meds. So a lot of newer psychiatrists are getting into what's called integrative psychiatry. So they're using supplements and medications and therapy and coaching and integrative like gut health lab work. So that's a lot of stuff I do. But a lot of psychiatrists are still just very med heavy, med focused. Like that's it. That's how they're going to practice. And so it depends. Like, how do you want to practice? Who do you want to learn from? Do you want to learn from someone who's more integrative or someone who's more traditional? There's no right or wrong answer, but it's just what you're focused on, right? There's other psychiatrists on YouTube, for example, Dr. Yosef, he does taper clinic. So he's focused on, like, obviously he's a lot more conservative, right? Then you have Dr. K who does more gaming stuff. So the point is that different psychiatrists have different expertise, different practices, different specialty areas. Like, oh yeah, here I could add in addiction as well. I could even add in here like research. So some of them are more research based, others are more clinical. So research versus clinical, right? So if you're practicing all in the clinic and you go to a psychiatrist who's like 90% research, then it might not be a good fit. And then vice versa. So that's really important too. So number two is cost. So you want to don't just find the cheapest option. You want to find an option based off of value. So typically, like a collaborator can range from 500 to 2000 plus. And on the higher end, they're going to offer other like higher level things, right? Like more direct messages. So maybe chart review, one-on-one calls. Those are some of the typical things that you might not get for the 500, and then better practice fit that you may not get in the 500. So you want to be, I've seen so many NPs just try to find the cheapest person. But if the cheapest person not really accessible, they don't really care about teaching you, they're not a good practice fit, and they may not even be the right credentials, then that's not really important. Then that's not really going to help you. So I would much rather you spend a little bit more, per month to find someone who's actually is a good fit for you and your practice long term. And, this is one area you don't want to be cheaping out in. And number one, most importantly, is the teaching style. So, right, teaching style and attitude. So, by teaching style, I mean, are they more direct or they're more like exploratory? So, for example, I've had attendings who my job was just to shadow them, like when I was in residency, and like I would just watch them and they would make all the decisions. And it was my job to just write the notes and execute on whatever decision that they were making. Whereas I had others who had me be a lot more independent and try to figure stuff out on my own. And then they would be a guide to help me in case I needed it. And then they would really try to challenge me to figure it out as opposed to me instead of just giving me the answer. Obviously, that teaching style takes a lot more effort. So I'll write exploratory versus authoritative or directive. Do they just want to be directing to you, or do they want you to more explore your own things? So there's a big difference there as well. And I think this is a better style to look out for. In terms of their attitude, do they view NPs as part of team versus just a source of revenue. So, for example, I see these collaborating psychs who have like 20 different psychs on their panel. And it's like, okay, like there's no way that you are actually providing the level of clinical care and competency that the person needs. Whereas if you view them as a part of the team, then you actually are invested in teaching them. You want to help them. You view NPs as a fundamental part of healthcare. Whereas if you're just worried about money, if the psychiatrist is just worried about money, then they might not do any of this stuff here, and their goal is just to collect a paycheck from you at the end of the day. So you want to be able to suss out for that kind of attitude as well. So these are the top things that I recommend you search for when you are looking for a collaborating physician. And so if you want a good way to find a good collaborating physician, you can network in our PMHNP coaching program. So we have over 200 students so far as of time of this recording, and we have a whole community section, and that's where people will all ask. They'll ask, okay, does anyone have a collaborating psychiatrist recommendations? And then other members of the community will share their various people that they know in their communities and their networks. So it's a really good way to find jobs and collaborations and that kind of thing in our community. So I would definitely recommend checking that if that interests you. Otherwise, I will see you in the next video.